Hello, my name is Lily. Today, I'm going to look at best practice guidance for the recording of chronologies. I'm also going to look at how this links through to our day-to-day work. Today's content is an annotated version of a local government practice program presentation. We will be answering 6 simple questions. These are: what is a chronology? Why do we need them? When should a chronology start? What information should be included? And finally, some tips for writing a good quality chronology. So, what actually is a chronology, in terms of children's social care? There are numerous definitions of chronologies. A simple one is a list, in date order, of all the major changes and events in a child's life. A more complex definition is that chronologies provide a key link in the chain of understanding needs risks. Setting out key events in sequential date order, they give a summary timeline of child and family circumstances, patterns of behavior, and trends in lifestyle. They are a means of organizing, merging, and helping make sense of information. They also help to highlight gaps and omitted details that require further exploration, investigation, and assessment. The next question we need to consider is why we actually do chronologies. There are many reasons why, but primarily, done effectively, it helps to place children at the center of everything we do. Using chronologies in practice can promote better engagement from children and families, and build positive relationships. They can assist the process of assessment, planning, and review, which then informs the work we undertake. When carried out consistently, they can improve the sharing and understanding of the impact of information about a child's life. This ensures consistent and child-centered practice. An effective chronology can help identify risks and patterns in a child's life. It can help in getting a better understanding of the immediate or cumulative impact of events. It can draw attention to seemingly unrelated events and information, and show the combined impact. For example, neglect by definition occurs over extended periods of time. The compilation of a timeline of events, which may individually not give cause for concern, may lead to an earlier identification of possible abuse or neglect. It helps you to make links between the past and the present, helping to understand the importance of historic information upon what is happening in a child's life now. Finally, a good chronology can assist with life story work, and at a later stage, help children, young people, and families make sense of their past. So, when should you start a chronology? The answer: a chronology should be the first thing that you do. Referrers should cite known history. It should start at the point of contact in the integrated front door team. This is because making a high-pressure decision against the clock is even harder if it's an uninformed decision. A chronology not only helps you to understand the child's lived experience, but also any gaps inform your next steps, such as questions and other agencies to contact about the situation. It also underpins so many vital tasks. These include reading the case file, assessment and planning visits, planning interviews, meetings with family, multi-agency work, and auditing. Professional judgment is required to decide whether particular circumstances or events are significant for a particular child. However, as a guide, a significant event is anything that has a positive or negative impact on them. It does not have to happen directly to them. It can be any change in circumstances or events that have, or may have, consequences for the child. Family and home events that can have an impact include births, deaths, and relationships within the family. Previous family history. Changes in family structure, or people living in the child's home. Any significant parental factors, such as domestic abuse, substance misuse, or mental ill health that may have an impact on the child. Changes in housing, such as moving house, or changes in placement for children in care. Health events that can have an impact include Child health issues, for example, mental health issues, attendances at accident and emergency, and out-of-hours services. Also changes of GP. Activities undertaken by the child that may have an impact include education, training and employment history, such as changes in school, absences or exclusions, starting training or work. Transitions and life changes such as moving from primary to secondary school. Out of the ordinary events, such as if a child begins to stay out late, or they have excessive visitors to the home, or a child going missing. Intervention impacts could include previous contact, referral, or service information, regular non-attendance at appointments, or non-availability at home visits, any changes in a child's legal status, meetings or professional activities where important decisions are made about a child's life, such as conclusions of assessments or receipt of referrals, any history of offences or police involvement. Finally, and very importantly, any incidents where a child is considered to have suffered harm or is at risk of harm. Here are some factors to consider when writing a good chronology. First, keep it accurate, factual, and relevant. It should not contain opinions, and should be focused upon the child and the key issues of the case. It should be well referenced and sourced. It should be easy for anyone reading the chronology to find the source, such as who gave us the information, or where it was originally written in the case record. It should be correctly timed with dates and kept up to date. It should be succinct and simple in format. If not, it will lose its impact. Don't include every single piece of case information you have, if it is not appropriate. Finally, as previously mentioned, consider the impact of every event on the child. What would be the answer to the question? So what? For any more practice information on recording chronologies, please contact your supervisor or lead practitioner by email or message them using Microsoft Teams. Thank you very much for watching, good luck with recording, and have a great day.